My name is Dr. Liz Simpson. I'm a senior lecturer at Ulster University in Northern Ireland. I'm a health psychologist and I'm also chair of the Division of Health Psychology's Training Committee. Well, COVID-19, I suppose, has impacted on us all, and I think on my work in particular, on one hand, I've over 10 years of experience teaching online because the master's course in health psychology that I'm course director for is an online program. It's always been an online program. And I suppose from that perspective, I thought that it would be relatively easy for us because everything would stay the same. The course would run on as normal. But what I suppose I hadn't anticipated was the number of students who were going to need support and help. Because it's an online program, our students come from across Europe and beyond, and they were all experiencing the pandemic at different stages. We also have some key workers as well, and they required a lot of support and help, and flexibility was really key, I think, to us moving forward. Not only do I teach in an online capacity, I also have a final year module which is taught face-to-face. And of course, we were faced with the prospect then of having to finish that module off and see the academic year out. Teaching online is not the same as teaching face-to-face, and it requires an awful lot more work. It requires you to think about your teaching in a slightly different way, how you're going to present information, how you can engage students, how you can create sort of like a community of learning within that module as well for students who are used being taught face-to-face and used to talking to you at the end of classes and things like that. So I suppose what we tried to do was like a flipped classroom approach where, we would have given them some recorded material to sort of consider and think about, and then engage them through weekly tasks and discussion forums, encourage them to sort of talk to each other as well as talking to myself and the demonstrator on the module. And we also then had an open book exam as well, which again was not something that we're used to, but it was the best way, I think, to kind of manage the exam context, virtually. It was really the only way that we could do that. I think one of the biggest challenges, not only for me, but probably also for our course tutor as well, who was dealing with students too, was really the volume of students, I think, and that we were dealing with, and the range of issues and problems that we were seeing as well, and the support needed for those students, just the emotional support, not only being able to give them sort of extensions to deadlines and things like that, but just the emotional support was quite draining. And you were listening to the nightly news and you knew what was happening around you, and then you were sort of seeing the impact of that in the lives of your students on a daily basis. So we did have some frontline workers among our student group who really just were absolutely floored by the pandemic and what they had seen and the experiences that they had had in their normal working lives, and just being able to sort of signpost them if we felt that they needed extra help and extra support.